Ambassador King, honorable ministers present here, our global leaders, member, Honorable Joy Pumapi, and from Aspen, Peggy Clark, Your Excellencies, distinguished ladies and gentlemen. I feel greatly honored and humbled to receive this prestigious award on behalf of the Malawi government. I know Honorable Pumapi did mention a bit of background about the Malawi program, but I will just quickly go through what we've gone through over the years. You may wish to know that the first Malawi family planning program started way back in 1982 and exclusively emphasized on child spacing. Under this program, family planning services were provided only at hospital level by nurses and clinicians. This approach made it difficult for the rural population to access family planning. The policies were also unfavorable for unmarried women because we're concentrating on those who already had children, and therefore the unmarried were not accessing. And also there was a requirement to seek consent from the husbands before using any family planning method. In 1992, the Malawi government took a bold decision by liberalizing family planning services with the view of ensuring universal access, after noting the negative impact that the previous approach had on these people. Since then and to date, use of modern contraceptive methods by women has increased sixfold. We were at 7% in 1992 when I first introduced it, to 42% now. And this dramatic rise in the use of contraceptive or modern methods is mainly attributable to a combination of use of community-based volunteers, known as community-based distribution agents, and also the use of community health workers in Malawi, known as health surveillance assistants, as providers of family planning services within the rural population where about 80% of the population lives. Honorable ministers, ambassadors, excellencies, and colleagues, it must be emphasized, or rather must be mentioned and emphasized, that this innovative approach to provision of family planning services has been made possible because of government's commitment and support at the highest level possible, as Joy earlier mentioned. You may wish to know that the Malawi government has repositioned family planning as a developmental issue and not as a health issue only. And only about a fortnight ago, we had a meeting where we brought together all players, not just the Minister of Health, but we brought in the civil society, traditional healers, Minister of Finance, planning, and everybody together so that we look at it as a developmental issue and not just a Minister of Health issue. And in this regard, the government has, for the first time, introduced a sub-theme on population in its development blueprint, which is the second Malawi Growth and Development Strategy 2012 to 2016. It is a belief of Malawi government that continued support from all stakeholders, we can sustain, with continued support, we can sustain all these gains we've achieved and achieve more. And of course, we can manage this only with your support. And thanks very much for continuing the support. And this has been quite encouraging, actually. And let me once again to express my gratitude for this award that I'm receiving this evening on behalf of the Malawi government and the people of Malawi. Thank you very much.